Welcome to Asnah Roundtable Discussion. Asnah Roundtable Discussion is all about the community. We are here to educate you and empower you. We are changing lives every day. Today we have another great topic on the table to discuss. It's all about you. I have here two panelists with me. I have Mercy Amo-Sekyere. She's a registered nurse. She works at Mount Vernon Hospital, and she is all about mental health. I have here Miss Ekua Marfo. She's also a registered nurse, and she also works at Mount Vernon Hospital, and they are both faculty of American School of Nursing and Allied Health. So welcome, ladies.
Thank you.
My name is Esi Gyenin, and I am the host for Asnah Roundtable Discussion. Today, the topic is all about the impact of COVID on mental health. So these great ladies are, I would say, versed in the topic. So we'll delve right into it, and we are going to give you good input. So, ladies, let's begin. So I'd like to ask a general question. What is the impact of COVID on mental health in the United States at this time? Mercy, I can start with you. Yeah.
All right. To start off with, mental health is a state of well-being whereby one realizes his or her own abilities to be able to cope with stress, able to control emotions, being able to be productive, gets along well with people. Overall, it does include how people think, behave, and act. So then COVID suddenly comes in, whereby people are being hospitalized, people are being killed or dying from COVID. Then it became very hard for people to cope with their stress or stress levels. As a result, then people began to develop symptoms of anxiety and depressive disorder, causing them to have difficulty sleeping, unable to eat. Some even became alcoholics.
Yes.
Yes. And then began to develop suicidal ideations from the depression. Some got laid off from work. There are some health workers, as of now that I'm even talking to you, are not even sure if they've also even developed the anxiety and depressive disorders, but you could see it all over or hovering around them. So overall, some of the impacts, just to put it in summary, is developing of the anxiety and depressive disorder, causing people to even have worsening of chronic illnesses. I personally know of a colleague who had to go on early retirement because he had this chronic illness and he was scared of the COVID and thought he was going to die, so he had to go on early retirement.
Oh, wow.
Yes.
That's a big impact.
That's
Yes. It has really affected lives.
To add on to what Miss Mercy is saying, I like the way she defined mental health. You know, the pandemic has made those who already have mental illness, it has worsened their illnesses. So for example, if you have someone who is already depressed, or someone who is bipolar, or someone who has anxiety, and you tell them that starting tomorrow, don't step out of your home, that alone is going to worsen whatever condition they already have.
That's right.
Also, telling someone who has all these diagnoses that because of the pandemic, we can no longer have you as an employee, and they get their medication from insurance.
That's right.
From the work that they do. And so the pandemic alone posed a lot of crisis on people, and those who didn't have mental illnesses, just as Miss Mercy was saying, all of a sudden they are developing OCD, because obsessive compulsive disorder, because if they were basing the pandemic on the virus, hence you have to clean thoroughly. So there were people who were washing their hands so many times to the point where their knuckles were all excoriated, because they in their mind, the more I wash, the better my chances of survival. So this pandemic, those who already have disorders, it heightened it. Exacerbated the disorders. Those who didn't have it got a new onset of their mental illness. And so it's brought a lot of challenges to mental health alone as a specialty.
That's right. Yes, everything that you're saying really makes me also think about how it has traumatized healthcare professionals, especially those that have those that have committed suicide. In terms of all this chaos going on, they can't cope. Not only that, as you work you get burned out. Once you get burned out, you transfer it also to your family, your loved ones, and it goes on and on and on. So it's lots of trauma, lots of suicide and things like that have also occurred.
As you were talking about how it has affected healthcare workers, I'm thinking about those that all of a sudden you have to stay home with your spouse. Maybe to begin with you were on the fence. Do I like him? Do I not like him? Get a divorce? Don't get a divorce? And then all of a sudden, right? I got to stay home with you 24/7.
How does that work?
How does that work? Because before, work was my outlet, right? And so now I have to breathe the same air you're breathing.
That's
right here. You know, so automatically marriages that were on the fence jumped over the fence.
That's right.
Because at that point, it was like I was tolerating you, but now I can't deal with you anymore, right?
That's right.
Yeah.
I really agree with you, Miss Esi and Miss Ekua. Just to add a few words about how this COVID also had impact on marriages. I do really believe that this COVID brought a ton of emotional toll on marriages because of the stress level. Just imagine, because of the pandemic, people are being thrown out of work and they are forced into lockdown.
That's right.
And they're facing this financial hardship. What would happen? There's so much stress, so they'll end up fighting each other and all that. There might be people that also have other relationships with other partners, you know, and then they had to be forced to be in the lockdown, and as a result, they were not getting the chance
To go out.
And eventually they got caught up. Because they
Yeah.
had to be texting their secret lovers, and then the other partners found out. All that brought a whole lot of fight.
But not to say, because you know, I think that you could also say that the secret relationships was what was sustaining this particular marriage.
Okay.
No, because if I am stressed out at home, and I have the opportunity to relieve my stress outside, when I come home, that stress level will be lower.
Trust me, some never even showed that they were really under tension at home. And so this COVID came up, that they found out that, so my partner, my significant other, really had been having external affair out there, you know. So all this really brought a lot of revelation. But with that said, there was also a research that I found that it's really helped one or two marriages though, in a sense that they felt more committed and became more appreciative of their significant other. In a sense that one gave a story of how she gave birth and there was nobody to come into her. And the husband was the only one who was there, had to help birth his wife, the babies and other stuff. She really then got to know how important it was to have her husband, you know.
So that's a positive
That
story.
was a positive story that I heard about. There was another story that I also heard that someone said she never knew the husband was that supportive. Although the husband wasn't working, and the woman rather got laid off from work. But then during the pandemic, where they found out that there was no means of paying bills, the husband had money in his savings.
Oh, wow.
And brought it up, helped them pay a lot of bills, which the woman was really appreciative. So, in a way, it did help too.
I think that in a way, it brought some positive and negative impacts
That's so true.
on relationships in the home. Children, of course, were affected.
Yes.
In a way, too, this is how we look at it positively, how
Yes.
partners and families were able to bring the family together, help out, do other things. So in a way, it did affect relationships in a nutshell, and regardless of how we look at it. Now let's talk about how it affected children in our homes. How COVID-19 pandemic affected our children.
I think children bear the biggest brunt of this COVID-19 because children are, I believe children bear the biggest brunt of this COVID-19 because children learn by association, children learn by interaction, children learn in their environment. And so if you are telling a 3-year-old, a 5-year-old to stay at home and not have social interactions, that is gonna impede or stunt their development. Because when you measure the development of a child, you look at the child as an individual and also their interaction with their surroundings, with the people around them. And so I strongly believe that we are gonna have an increase in behavioral and developmental diagnosis as a result of this pandemic because children were forced to stay at home. And so maybe by them playing with others, that is how children learn. And if they can't go to school to learn with each other, they are forced to stay at home. It's unfortunate that we're going to see an influx of developmental delay in children.
I definitely agree with you, Ms. Ekua. Just to add few to it, I also believe most of these kids are going to develop symptoms of anxiety, later on PTSD and depressive disorders. Why is it so? There's some of these kids that had to be separated from their family members and friends because such friends got COVID, and they had to take these kids away from them. There are some of these kids that had never even had the chance to go for gatherings, had not gone for programs. All they know is placing masks on faces. That eventually when this mask wearing fades off, I believe they wouldn't even feel comfortable. They wouldn't even be able to differentiate what is best from what, which I think it is really a problem. That is why in the near future it's going to cause a lot of trauma. A kid may be young and would hear about COVID in the near future and wouldn't want to associate himself or herself with this pandemic because of what the story that comes or goes behind. Might have lose a loved father, a greatest grandfather and all that. So I think that is really something that is a bit worrisome. And to add a few to it, mothers too really had been going through a lot during this pandemic. Why is it so? Look at full-time mothers that out of nowhere COVID set in. Temporary school closures.
Yes.
Mothers had to readjust themselves and then adapt to the system. They needed to be home, be teaching their kids and all that. It caused a lot of challenges to the mothers as well.
I think also the family in general, we've been talking about family, the family in general, because you may have a single parent who works while the child is in school. And so that parent comes home when the child is out of school. And so you telling this parent that your child has to be at home. Who is going to supervise this child while they stay at home? And it's not even in the pandemic that that has gone by, but recently, when your child is in school and there's a child in that class that is diagnosed with COVID, the entire class has to be isolated for 10 days.
That's right.
10 days.
Yeah.
10 days. And so in those 10 days, who is watching the children? Is these same parents who have to stay at home and watch the children. However, they are being mandated to go and work in the hospitals, be an essential worker, work in the grocery stores, in other areas, police officers, EMTs. So the struggle and the stress is more than real, and it's we are going to see a lot of psychological, mental health, behavioral health complications as a result of this pandemic.
I also feel with children, the developmental delays will be a big factor because, like you said, children learn by associations, learning from each other, friends and things like that. But in a home whereby you are not supposed to, let's say there's everybody in the family had COVID, or they are not supposed to interact with other children. How do they learn these social skills, communication skills, behaviors that go along with it? So really, as you said, it's going to go a long way, and we are now going to really see the impact of it as we go along.
Funny to say, you know how before when you go to your pediatrician, the pediatrician would say limit screen time. That was what was being preached, right? Limit screen time. Limit screen time. How old is your child? Give your child only 15 minutes of screen time in a day. You are telling this child to go to school on the screen, right? On the screen. So a good 6-8 hours of the day, this same child is on the screen. The reason why you were saying limit screen time at the beginning hasn't gone away, and so
the purpose has been defeated.
Yes, the purpose has been defeated.
That's right.
And you realize that children who utilize screen time a lot have several developmental delays.
Yes.
Because they are getting the feedback. They are getting what they need from the screen.
Exactly.
Hence, there's no necessity for them to use the environment.
That's right.
So it's at the end of the day, it's
a
coming.
problem.
It's rolling
It is
on.
a problem. Now, what would you tell parents out there as they're watching us, how they should help their children with COVID-19 pandemic and these mental issues that are developing? Now, we'll be right back.
America's School of Nursing and Allied Health. Are you looking for a reputable nursing school that will equip you for the future? Asnah is the answer. At Asnah, some of the programs we offer include practical nursing, phlebotomy, nurse aid, medication aid, and home health aid. We also offer CPR classes. We have an ultra-modern library that helps make learning fun, a state-of-the-art simulation lab for all of our courses, and a well-equipped studio to help reach the community. We have well-trained and dedicated instructors who are here to ensure your success. Here are some pictures of our past graduation ceremonies. We believe, we inspire, and recreate. This is our mission statement. Asnah has the right atmosphere to help you attain your goals. Asnah, we will help you follow your dream. For more information, please visit our website at asnahonline.com or call 703-490-8402.
Thank you for watching Asnah Roundtable Discussions. We are back, and please do not forget to subscribe, share, and like. We are talking about mental health issues and the impact we are talking about COVID-19 and the impact on mental health. And ladies, let's talk about, as parents, how do we help our children through mental health issues if we recognize or see our children having these symptoms or behaviors? How do we help them?
I would say that first and foremost, as parents, you should be aware of your own mental health biases. You should be aware of what you are predisposed to. So, because children learn what is in their environment. And so if you have heightened anxiety, chances are that that child is going to pick that up. If you have depressive disorders, where there are some days that you are morose, there are some days that you can barely pick yourself up, that child is going to learn that behavior. Of course, there is nurture and nature, right?
Yes.
There are certain things that are innate, certain things that come up as a result of their genetic pool. That is one side. There are other things that they learn in their environment. And so, as parents, it's very, very important that we know what our mental health status is, so that we are able to mitigate or resolve our problems, just so the children do not pick it up.
That's right.
That is one. Two, be informed. Know where your resources are.
Okay.
Know your resources, because when you know where to go, you may not know it all, but at least you know that if I see these early signs, I should take my child to the pediatrician.
Okay.
Early signs, I should take my child to developmental specialist.
Okay.
So knowing the resources you have at hand, you'll be able to point the child towards the right direction.
That's right.
So that at the end of the day, we're all going to have it.
Let me just throw this in real quick. I know that there's lots of hotlines, crisis hotlines that people may tap into online everywhere. So I think that's one of those places that you can go for resources, just to reinforce what you just said. So Ms. Mercy, what do you say?
All right. I think mothers should also know their kids' behavior well. We have to be very observant. Parents should spend time with their children. So when you see any abnormal behavior popping up, please do not look down on it. Do not look down, and then look up for the numbers and places where you could take the child to for early intervention. I think that will help.
Yes, and to add to what Miss Mercy was saying, also I believe that when a child starts to show certain signs, the sooner you are able to get resources for the child, the better the outcome. Yes. And so we should also look into early intervention, making sure that as soon as we notice those signs and symptoms, don't wait. Have the child seek or take the child for help. I remember, nurses, when even before the pandemic, as soon as you walk home and your child is about to give you a hug, you're like, no, wait. Mommy gotta go take a
That's
shower.
right.
And then after that, they will come and
That's
give you a
right.
hug and all of that. But now it's even worse, right? Mommy is not, you wouldn't even see mommy until mommy has completely taken a shower, has taken off everything that they go to work with and come. And so some of these things, it decreases the bonding time, right? And so we have to be very strategic and skillful as to how and when we bond with these children. Instead of our, normal hugs when you first meet, tell the child that because you are so special to me, I want us to hug after mommy has taken a shower, just so that I don't bring the germs from outside to you, just so that the child will be able to understand. So bringing down the pandemic and explaining it in simple terms to a 2-year-old, to a 3-year-old, that will also help them to understand and be able to integrate in a new environment where social distancing has become the norm.
That's right. Another thing that I also want to throw in there was the diasporan aspect and what they believe in mental health. Yes, mental health is a big deal, but sometimes diasporans or immigrants do not buy into the idea of mental health. And this is something that as healthcare educators, we that are here in American School of Nursing and Allied Health would have to bring that into light or teach our students, or just in general the community that has high population of diasporans, that mental health is real, and it's a mental health condition, just as if you had a chest pain or any type of diabetes or any type of mental illness. It is. And they would have to believe in that or understand that. Because once we understand that, then we can pick up on these symptoms that we are talking about, depressive symptoms, anxiety symptoms, and then really report it or take it to the next level and get resources for our loved ones. But if we don't buy into it or, understand it or don't believe in it, it becomes a big challenge and a big problem for the entire family, community, and everybody else. So I think this is a point that we need to always stress on.
Right. Also, I think just to add to what Miss Esi was saying, I believe we immigrants or we, the diasporans, we have a different belief system. What? You are depressed. Go look at the person two doors down. That person didn't have breakfast to you. You ate this morning and you're talking about what is making you depressed. But there could be a genuine underlying disorder brooding, right? And so we should be more embracing of mental health disorders. It's just like Miss Esi, you said that mental health is, or behavioral health in general, is as common or as simple as someone having a headache, right? You can have a headache once in a while. Someone could have a headache constantly, and so that person may need more help than someone getting headache once in a while. Think of it that way, or having high blood pressure. Usually by the time you are diagnosed with high blood pressure, your blood pressure is so high that you need medication, immediate intervention. And so when you see someone isolating themselves from the community, don't call me. When you call them, I'll call you back. And after a month, you still haven't heard from that person. Check on that person. Make sure that when you see someone who has mental ill disorder, don't shun on them. Embrace them. Bring them closer. Because at the end, especially, we have a lot of diasporians who work in the health sector. And everyone, I know about nursing education. In Asnah and elsewhere, we educate people on mental health. That knowledge should be passed on.
That's right.
That knowledge should be passed on. It's going to get to a point where mental health is going to be normal.
Exactly.
It's going to be like any other diagnosis.
That's right.
So that should be our goal as healthcare professionals.
Just to add a few to it, I also believe that people should not associate mental health with that of spiritual aspect. A lot of people really have that perception, so then they fail to seek early intervention. Please get to know when someone is withdrawn to himself or herself, loses interest in any pleasurable activities, you would want to get closer to the person to find out. There are a lot of information out there that you could read, get closer to people, spend time with your family members, their children, and ask questions and then seek early intervention. That will help.
I think you guys have said it all. And in wrapping up, I would say that mental health issues are real. Especially with the diasporans, we have to take care of ourselves. And with all of us, just because of COVID-19 is here and has really affected everybody's well-being. So once in a while, I feel check yourself, check your temperament, check your mood, and ask yourself, am I okay? If you're too stressed, these kinds of questions helps you calm down or assess where you are, also mentally. And as a community, we should learn how to reach out to each other, ask for help, and all the things that we can do as a community to alleviate our burden. I think that's something that we should look into. So thank you, ladies, so much. Please introduce yourself at the end again so that our audience will get familiar with you.
All right, so I am Mercy Amo-Sekyere.
Ekua Marfo.
Great. My name is Esi Gyenin, and thank you so much for joining us for Asnah Roundtable Discussion. As always, Asnah Roundtable Discussion is all about the community. We are here to educate and empower you. We are changing lives every day. Please tune in share, subscribe, call a friend, let a friend call a friend, and we will see you next time. Thank you.
Bye.